This is the MedicCast, January 24th, 2011.
Transmitters? We don't need no stinking transmitters.
This is the MedicCast, a podcast for EMS providers by EMS providers, featuring EMS news, products, tips, tricks, and commentary. So grab your gear and glove up. Here's today's show with the pod medic, Jamie Davis.
Good day and welcome to this week's episode of the MedicCast. I'm your host, Jamie Davis, and I'd like to welcome everybody to the show this week. You know, I call myself the pod medic, but it's because I really am passionate about podcasting and all the things that are available here in this space. And we just continue to add great programming over at the ProMed Network and great EMS podcasts coming along out there. And I hope you will continue to support and continue to show your support for this show and also the other great shows that are out there in the EMS setting. And just wanted to thank you all for that as we are in our new year here. Do want to remind you to follow up on the information in this episode over at mediccast.com/blog. We'll talk more about that later. And also, don't forget to catch up with me and respond back to me with any questions, comments, suggestions for future episodes, or any perhaps other things you want to chat with me about. Maybe you have a correction I need to make. You can go ahead and get in touch with me by sending those emails into podmedic@mac.com. And I love to hear from you, and I try to get back to each and every one of you when you send in an email that way. Of course, you can also call in on the voicemail line, 941-306-3342, 941-30-MEDIC. And I did get a voicemail this week. I'm going to see if it's playable. It had some, I guess there was some cutouts because it was on a cell phone. We'll listen to it maybe in coming up in the listener email segments, but it's great to hear from the listeners. And also, don't forget to check out and follow me on Twitter and Facebook if you want to catch up with me that way. Some people send me messages through there. So it's always great to have you check out and follow me on Facebook or Twitter. And again, that's over at twitter.com/podmedic and facebook.com/podmedic. That's it. We're going to get on into our listener mail segment here in just a sec. Let's jump on into listener email. We got quite a few things to jump through here. First off, I got an email from Peter. He checks out the show, and he's also an editor over at Wikipedia. And for those of you that don't, everybody knows who Wikipedia is. What you may not know is that those articles are edited by the users, essentially. It's one of the reasons why it can be questionable about the quality of some of the information there. If someone has an agenda, they can edit the information in a particular article, and it can get out to a lot of people before it's caught. However, they don't have anybody really doing any kind of EMS review or editing over at the Wikipedia site. And I got an email from Peter asking me if I could do it, and I'm swamped. Obviously, I do this show and several other shows every week, and I'm not sure that I'd be the best person to commit to doing that, but I would ask you, do you check out Wikipedia EMS articles, and do you follow on that information? And would you be interested in lending a hand being one of the editors over of the EMS content at Wikipedia? You might be something you could do once a month. Just check out a couple of articles and update them, make sure they're authoritative and have good links backing them up. If you're interested, you can follow more and learn more about it by, let me see if I can get the article link here. If you go to wikipedia.org/wiki/Wikipedia with a capital W :EMS, capital EMS. So you can do that, or you can just do a search for EMS articles and start looking through them and seeing what is interest to you. And I think it's important for us to curate our own information. And while I may not have the time to necessarily do that, maybe we can enlist some of the MedicCast community to start lending their support to Wikipedia and start editing. And I don't think there's a Wikipedia entry for the MedicCast or for me. So maybe somebody wants to put those over there and start an article on podcasts and EMS. Certainly that's available for you there. So check that out. Moving right along, I also got an email from listener Greg Fries. Of course, Greg is not just a listener, he's also a podcaster. Greg was checking in to say he's excited about producing some programming down at EMS Today coming up in Baltimore. And that starts March, I think the conference is March 1st through the 5th. So if you're able to get down to Baltimore and check out the program down there, we're going to be podcasting live from the exhibit hall floor. You can catch me, Chris Montera, and also Rick Rosati, Greg Fries, and many others. We're going to try to have a variety of different programs produced down there. Natalie Quibido will be there doing some Gen Med show stuff, and I'm really excited to have you stop by. So everybody that's in the area that's coming to EMS Today should come down and check out EMS Today and come by the podcast booth. Get a bite to eat if you're taking a break, and there'll be chairs for you. You can sit in the podcast booth, eat your snack or your lunch, and listen to the show that's going on currently. We're going to have programming pretty much constantly throughout the day whenever the exhibit hall's open, and I would urge you to come by, meet your favorite podcasters, stop by and say hello. Now, don't be shy, come up and say hi. I love meeting everybody, and I know all the other podcasters feel exactly the same way. If you want, shoot me an email, let me know you're coming, or check out what's going on over. I'll have schedules and information posted over on the MedicCast Facebook fan page at facebook.com/MedicCast, so you can follow on the schedule there, and of course follow the Twitter updates and things that we'll be posting to let you know what's coming up over in that show. And I look forward to seeing you. And Greg, I'm looking forward to having you around and checking out what you're doing with the EduCast while you're down at Baltimore. And it's going to be a great time. I'm really looking forward to EMS Today coming up the first week of March. I want to check out a couple of messages I got. First off, I got a message from Daniel over on Facebook, one of my Facebook friends, and Daniel was checking in about the EMTB National Registry exam, and he was under the mistaken impression that he would have to know some ALS skills such as endotracheal intubation or dual lumen airway use, and that's not the case. To find out more, I gave him a link and sent him over to the National Registry site at NREMT.org. You can find the instructor skills manuals, and it has all the downloads for both the BLS and the ALS skills tests, and the PDF that the actual preceptors use to check off your scores. So there's all those materials and resources over at the National Registry website, and I would urge you to use that website to get information, and I was happy to be able to straighten Daniel out and get him the correct information. If you want to find out more, just want to get the link directly, there's a link over at mediccast.com/skills. So you can go to that link, and there'll be a link there to the National Registry site for you to follow. Also, just real quick, I got a message from listener Brendan, and Brendan was just checking in, and let me see if I can find his message here now. Brendan just checking in, and wanted to let me know that he enjoys listening to the MedicCast, and also that he recently was hired by an EMS agency in Florida as a paramedic. So, hey, Brendan, congratulations. And I love to hear from all of you when you pass exams, do well in school, and maybe attribute the MedicCast to some part of that in some small way. It makes me feel good, and it's one of the reasons I do the show. I started doing this kind of thing to help educate myself and help me retain knowledge more efficiently, and I'm glad to hear that it's having that same effect for those of you. So again, Brendan, thanks for checking in, and congratulations on your new job, and I hope to hear from other listeners as well. Did want to check in. I heard from listener Sean, and I was listening to his voicemail. It's really just scratchy, so we're going to go ahead and just relay to you from listener Sean. He was asking about CPR recertification, first aid recertification, and he's an EMTB. And it's one of those things that we should be getting new materials from the American Heart Association for the new guidelines here in the next 6 months or so. It takes time to roll those things out, and certainly, recertification is an important thing for CPR on a regular basis. We've seen the scandals associated in the Northeast with different organizations fudging their CPR and EMTB recertification numbers and statistics so that people can recertify without actually going through the continuing education or the classes. Not a good thing. It comes down to this. If you want to be a licensed or certified medical professional, as every EMTB and paramedic is really, you have a responsibility to maintaining your knowledge and your certification at a level that enables you to effectively and safely treat your patients. And when you circumvent that safety level, you're committing what I consider to be negligence. Because when you then treat a patient, you have not maintained your level and falsely treated a patient under a level of care that you no longer attained. And so this is often the case of fire departments and police departments that have to be EMTs to maintain their job status, but don't feel like they have to have the knowledge anymore. And why should they recertify all the time? Well, you know, if you get another job. You can be an electrician or be a plumber or be a ditch digger for all I care. If you're going to have to be an EMT, then darn it, be an EMT, and that includes the continuing education that goes along with it. Let's look at this week's news items, and I'm going to start off with a story from the Finger Lakes region, and this is from WaynePost.com. You know, this is a time of year when a lot of organizations are seeking new members, and of course, because so many volunteer fire and EMS services are still in existence in the United States, seeking new members and retaining old members is an important part of EMS services in many places. And that goes for the case in my region, many volunteer organizations and EMS services around here. So we certainly want to make sure that we understand the urgency for retaining these valuable members of our community with whom we could not have ambulance service in many places if there weren't volunteers. And so I just point out a great article here that talks about the need for new volunteers and coordinating that care. Talks about how meetings are set up. And so if you're part of a volunteer organization, fire or EMS, and you want to educate your public. We talk about educating the public about EMS in general. We should also be educating them if you're a volunteer organization and you want more volunteers. Let them know what the requirements are. How often do you have meetings? What kind of training can they expect? Does it cost them anything? All of these things are important to relay to your public so that you can get the volunteers that are really interested in doing and fulfilling the needs that you have. And this is a good article to look at that. So I urge you to check out that link in the show notes. Next up is a look at another article, another type of outreach and education that you can do. And I've talked about these in the past where a local EMS service maybe has a press release or has a regular column maybe once a month in a local newspaper or a website and talking about how the EMS care works. In this particular case from Durham, North Carolina, the Durham Emergency Medical Services agencies got together and are putting out this article on how important it is to quickly and early and rapidly identify cardiac events in patients, heart attacks and strokes and things like that, because time is of the essence. We can have a more full recovery if we get to these patients more quickly because of the onset of chest pain or stroke symptoms. We can more rapidly treat those patients and get them the care they need. So this is a great article that explains why that's important, explains some of the things to look for, how our EMS services work, and how we can prepare the physicians at the emergency department if you have a serious emergency, what to expect, activate things like a cath lab and things like that. You can explain or do a whole series of articles on this kind of thing, or work with your local newspapers, have somebody provide the information to one of their staff articles or staff authors, reporters, and have them write the article for you if you don't feel comfortable writing press releases or news stories like this. But you can certainly, I think, use this particular article as a starting point, and I'm not saying plagiarize it, but certainly use the same structure and similar information to make your own article and then release it to your community as well. And just a good example of getting information out to your communities, and I think that's kind of the focus on this week's news items, is different ways that we do that. So is there a bad way to get information out to our communities? Well, according to a recent study, YouTube is rampant with bad information. Now, that doesn't surprise anybody. I mean, heck, it's got kids whacking themselves in the crotch with baseball bats and skateboard accidents and cats riding bicycles and everything else out there. So why wouldn't there be some interesting other unusual things that might not be of any kind of social value. Well, guess what? A lot of places, and I've featured them here on the show CPR demonstrations in different ways. And sometimes they use it as a marketing tool. We've covered it here on the show. If you want to check back at a previous episode of the MedicCast TV weekly commentary, you can see an episode I did on a sexy CPR video that I found. Fun to watch for the bodies involved, but not necessarily good quality CPR. And that's what this article that I found to close out the news today is about, that much of the information on CPR available on YouTube is incorrect. So like anything else on the internet, this is, great. Okay, so the CPR demonstrations on YouTube aren't all the correct way to do CPR. That's not a surprise to me. People need to be careful consumers of information on the internet, whether it's video, audio, or pages. And it just goes to show that people still haven't learned this lesson, or at least some people are still amazed when they find out that they do need to be more critical consumers of information on the internet. Because anybody can post a YouTube video. I mean, heck, you can show your dog doing CPR. It doesn't mean they can do effective CPR. Just as cute, right? Well, I think we need to make sure good information is out there. However, there's a place for this. Even though it might not be the best CPR being shown on some of these videos, at least we're educating people, they're giving them an approximation of what might be required of them, and therefore gives you a springboard to better treat your community by educating, by getting more people trained to do proper CPR. And heck, why not do a training video or a brief video on your own company website showing the proper ways to use CPR, or even better yet, just easy enough to find a good CPR video over on YouTube, one that's done correctly, and embed that particular video on your website as a good example of quality CPR. So there's lots of things we can do using YouTube effectively, and we can again use it for a discussion point when you go and teach CPR in your community and educate your instructors to do the same. And you can be using the tools that are available on the internet responsibly and effectively in all of their iterations, whether it's a super sexy CPR video that isn't really good CPR, but heck, it's got good looking people in it. There's value to that. I don't think anybody who's ever watched the Mr. Bean episode where he resuscitates a patient with jumper cables hooked up to a nearby lamppost thinks that that's the way you defibrillate patients. But heck, it's funny as heck to watch. So I think we need to keep these things in mind and understand that there's a place for all of these things. And if anything else were to come of it, at least it's an opportunity for a springboard into the discussion on why learning CPR correctly is important. So again, you can use this article as a possible link to have a talking point with a local reporter and use it as a way to talk about upcoming community-based CPR programs you have in your area, and encourage the public to come out and learn the right way to do CPR. Again, follow up on the links in the show notes for these articles. Again, you can find that over at mediccast.com/blog, and there's a link for show notes right at the top of the page. You'll find the most recent episode listed first, but you can scroll down and find this or any other episode in the past by just going down in reverse chronological order. And I urge you to follow up, again, on these news items and see how you can use them in your own EMS practice. Let's jump on into this week's tip and trick of the week, and we're going to be talking about stroke care in this week's episode, following up to last week's basic stroke care overview. And one of the things I want to talk about is the importance of monitoring and managing blood sugar and other aspects of awareness that we need to have about what's going on with stroke care. I think that too often we focus solely in EMS on what's happening in our little world, our 20 minutes, our 10 minutes, our hour with the patient, and not on long-term care implications for that patient and some of the things that other members and parts of the healthcare stream that this patient's going to travel through will be able to implement. And so we should keep in mind some of these other things. Also, important aspects and things to keep in mind and monitor with our stroke patients and understand effects of these things. So we're going to talk about hyperglycemia and post-stroke care. And really, because it's important for us in so many ways, whether we transport patients between facilities or we have a long transport time, hyperglycemia affects the body whenever it's in stress. That could be from multi-system major trauma to something like a recent major surgery, and of course including strokes and myocardial infarction. So understanding these things is important. So first off, we're going to cover a brief stroke review, just a review of what is stroke and what causes strokes. If you want more of that and more information on stroke in general, check out last week's episode. We're going to talk about brains and blood sugar. It's important to understand some specific things that are unique to the brain as an organ and the nervous system in general regarding use and how blood sugar works in accordance with the brain. We'll look at some specific research and studies that are going on, recommendations and standards of care for stroke patients, and that includes the EMS sector and some things we should keep in mind, and also the EMS role in prevention and awareness for these patients. So let's talk about strokes. In general, strokes, again, are thought of as brain attacks. We need to think about them in the same lines as we think of patients like our cardiac patients. With heart attacks, we need to think about brain attacks. Sudden loss of blood flow to a part of the brain with a neurological deficit lasting longer than 24 hours is the clinical definition of a stroke. Of course, we talked about TIAs or mini strokes. Those are strokes that have self-resolving symptoms. Are they not severe? Well, in the short term, they're not severe. They self-resolve. Are they severe for that patient and long-term outcomes? Absolutely. Because if a patient has a TIA, a transient ischemic attack, that mini stroke, that is an indicator that they are at much greater risk for follow-up full-blown strokes within the days, weeks, or even months following that TIA onset. Patients are very frequently going to go, oh, it took care of itself. I guess it wasn't anything. We need to make sure, again, this is an educational issue with our communities, to educate them to take these symptoms seriously, even if they resolve on their own. We should be monitoring and letting patients know that this is something that they need to be aware of. There are two types of strokes, ischemic strokes and hemorrhagic strokes. Ischemic strokes are caused by thrombus or blood clot, and they are accounting for about 85% of the strokes. Hemorrhagic strokes caused by intracerebral or subarachnoid bleeding, and they account for about 15% of all strokes. And again, TIAs are those transient strokes that have self-resolving symptoms and should be taken very seriously. So let's look at the brain and how it uses blood sugar. I saw one particular resource that I was looking at recently said that the brain is a sugar hog and accounts for 20% of the energy usage in the body. So 20% of the blood sugar in the body goes to be used by the brain at any given time. And it's a hungry organ. There's a lot going on in the brain. And all of that electrical activity takes energy. And that energy comes from blood sugar. One of our bigger brains, as human beings, we have bigger brains. Our bodies and brains use a lot more energy in proportion to our bodies and what we take in than any other animal, because we have so much going on, like listening to podcasts or writing articles or reading or everything else on top of the everyday things that your body has to do to operate. The blood-brain barrier. Let's do a brief anatomy and physiology review and think about this unique aspect of the brain. The blood travels throughout the body, and in most cases, the cells just grab things directly out of the blood. The blood itself passes things through the membranes very easily. There is a blood-brain barrier in the brain that limits the things that can cross this barrier. And it's a safety measure. It keeps toxins and other things that aren't good for the brain out of the brain. But one of the things that goes into the brain very easily is sugar. And of course, that's good. We need to get that sugar across this blood-brain barrier so that it can feed the neurons and cause the brain to continue working. But it's important to understand that the brain doesn't have any resources or supplies once that blood-brain barrier is crossed, or if there's anything that interrupts blood flow to the brain, it is going to rapidly cause an infarction and ischemia to the brain because of the fact that there are no oxygen stores, there are no sugar stores, and this is going to reduce the availability of things for the brain. Interesting statistic that recently came up, and this is where we come into this whole understanding high blood sugar and how it affects the body in stress situations. Strokes, about 2/3 of all patients present in the emergency department with their stroke and have hyperglycemia. This is defined in this particular study as a blood sugar greater than 108. So if you're looking at a patient with hyperglycemia, even slight hyperglycemia, and if we think of our normal numbers for blood sugar of 60 to 100, over 100 is high blood sugar, but 108 is not extremely high. I mean, you think high blood sugar, you think, 180s, 200, 300. No, we're talking just slightly hyperglycemic. And this has had an indication for poorer outcomes for these patients. Hyperglycemia encourages ischemia to progress and occur. And this is seen and understood in cardiac studies and in major system trauma and major surgeries. All understand the need to understand and manage blood sugar. The same thing is true for our patients that have strokes. And this is because of the fact that high blood sugar encourages anaerobic metabolism, lactic acidosis. It increases the amount of free radicals produced and speeds up the production and action of cell lysis, the breakdown and tearing apart of cells that occurs as cells begin to die. So anything that increases, you have a stroke going on and maybe a certain part of the brain is affected. Perhaps it has a complete effect and cells are dying or already dead. If you have hyperglycemia on board, that is going to put that patient at an increased risk for that spread to happen more rapidly and to have the total effect of their stroke be much broader in scope. And so a patient that might have had a mild stroke and possibly a near full recovery in the presence of hyperglycemia, that same patient would have a poorer outcome and more chance of having a long-term disability associated with their stroke. There's been a lot of research and studies, and I don't want to go into all of them. I would urge you to check out the EMS Research Podcast if you like EMS research studies and want to know more about them. But a few things on insulin resistance that are discussed and different aspects of blood sugar and how they affect the body. And so I would just urge you to check out the links in the show notes, especially the American Heart Association Stroke Guidelines, and there's a journal article there on hyperglycemia and stroke care. And I would just use these articles to point out the fact that the body has a specific reaction to stress. And we've talked about it here on the show when we cover sympathetic nervous system in the past. We talk about that fight or flight response, right? In a fight or flight response, the body is, essentially this is an old mechanism that prepares us to run for our lives or fight for our lives. And one of the things that happens when your body thinks that the tiger is getting ready to eat you is that it releases more blood sugar into the system. Now, this isn't to make you taste sweeter to the tiger. This is to make you have more blood sugar available to run away or to make your muscles fight more effectively longer when you're fighting for your life. However, your body can't tell the difference between multi-system trauma, between a surgical situation, a cardiac arrest, or a major cardiac event, or a stroke/brain attack. It doesn't know what kind of attack that is, and it doesn't understand that, wait a minute, we don't have to run away or fight for our lives against a tiger. This is a problem in our brain. Doesn't know that, so it can't tell the difference. And so everything that happens in a major stress reaction and in that sympathetic nervous system response, including increasing the amount of sugar available to the bloodstream, is not necessarily good for the body in these other situations. So that's what this particular study is looking at. And it's important for you to understand that this happens anytime the body experiences stress. That's why it's important to manage your stress. If you have high blood sugar, even if it's because you're having stress at work, because remember, your body can't tell the difference between your boss screaming at you and a tiger in your face, it just continues to ramp up the blood sugar. And this increased blood sugar, even if you're not having a stroke, is making it so your body is not homeostatically balanced the way it could be. So managing stress is important. And so that's important to understand with our patients as well. And that's why I think this is an important article and important segment to do here on the MedicCast. I was hemming and hawing about whether or not I should cover this on the MedicCast. I've talked about it on the nursing show, but I think this isn't just for that in-hospital patient care setting. We need to understand the whole spectrum of what's going on with these patients, because anything you can do to help that patient relax reduces their stress levels, reduces the amount of blood sugar released into their system. So we need to maintain calmness in the back of the ambulance. We need to manage our patients. Despite what's going on, we need to be calm and cool and collected and never let them see you sweat kind of mentality. Because a patient who gets upset because you're upset means that they're releasing more sugar into their system, and whatever's going on with them, and even if it's something relatively mild, we have now caused them harm. Okay? It's that simple. When we cause an increased release of blood sugar, we cause that patient some form of injury based on whatever's going on with them. So it's important to understand how stress hyperglycemia works. And this happens in patients who are diabetics or not diabetics. It's more pronounced in patients who are diabetics because they already have sugar management issues, but it happens in all patients. Also, the other thing to keep in mind is we are to do a blood sugar stick, at least in my protocols and system, anytime there is an altered mental status. We should be checking blood sugar. Anytime we suspect something that's altering the brain chemistry because of that blood-brain barrier and the need for constant supplies of sugar, if blood sugar is low, the brain could be affected by it, so we should be doing that. And that includes stroke care. So let's get a baseline blood sugar for this patient, include it in the patient record, make sure we report it to the hospital so that they can be aware, hey, based on our testing equipment, and again, it's basic blood sugar testing in the field, not the same as a full lab test, but based on what we've got, this patient has a blood sugar of 140. Okay? We've now advised them this stroke patient or this trauma patient or this cardiac patient has hyperglycemia. And again, this can more rapidly follow up because hospitals and programs are looking at more aggressively managing this hyperglycemic state by administering rapid action insulin to these patients to get the blood sugar out of the bloodstream. And so I would urge you to implement the thought process on this for EMS is, hey, I need to be checking blood sugar on every stroke patient. Yeah, because A, they're altered mental status, so it's going to be in your protocols almost guaranteed. And B, because reporting hyperglycemia early to the hospital is yet another way we can improve the outcome and the ability for this patient to walk out the door on the other side. And again, this isn't just strokes, it works for cardiac arrest and cardiac events like myocardial infarction, and it works for patients that have multisystem trauma. Something to keep in mind. The stroke standard of care is set by the United States Heart Association and the United States Stroke Association. They're essentially combined organizations. They just have separate staffs and stuff, but they really work very closely together and are really part of the same parent body. And the European Stroke Association are in lockstep on this stroke standard of care that we need to reduce blood sugar in stroke patients, including and monitoring non-diabetic patients, and this includes all patients, including hemorrhagic and ischemic strokes. The studies are mostly focused on ischemic strokes, but hemorrhagic strokes are included as well. And again, insulin therapy is recommended. Now, there are some EMS services out there that may administer insulin. And you might want to talk to your medical director about whether or not, if indicated, a unit or two of insulin might be indicated for that hyperglycemic stroke patient. Get that glycemic index down even lower, quicker, even by 10 or 20 minutes, could improve an outcome significantly. So for those of you out there that do have insulin in your kits for EMS, it might be something to consider. Not too many of you, but there are some out there. And if not, definitely want to include a blood sugar reading in your report to the hospital en route for stroke care so that they can be ready to more rapidly manage hyperglycemia in these stroke patients. What's our EMS role? Well, we need to be good stroke assessors in general. Check out last week's episode for a review of the Cincinnati Stroke Scale. We talk about some other scales used to monitor and manage stroke patients. Also, understand and review the anatomy and physiology of the brain, of how strokes occur, and of how blood sugar is used by the body's cells in normal and abnormal situations. Make sure you are understanding and using blood sugar monitoring in your ambulances effectively. Understand your protocols for when you can get a blood sugar. Talk to your medical directors about the fact that you'd like to make it standard operating procedures for stroke patients to implement blood sugar if it's not already there. I would argue that any altered mental status patient gets a blood sugar check, so that means stroke patients. They're having some kind of brain function alteration, so we should be checking their blood sugar. Manage your patient and their temperature carefully. And I say room temperature in this particular slide, but it really means the ambulance, the patient temperature. If you think about the cascade of things that can cause a shock patient to rapidly decline, some of the things are blood loss, lack of oxygenation and acidosis, and then also temperature. They become hypothermic. So we want to maintain our stroke patients in a sense that we can help them maintain their homeostatic balance as effectively as possible, and that includes maintaining their levels of temperature in their body. And if we can help do that for them, it's less work they have to do that, and they can devote more resources towards trying to take care of the ongoing stroke situation. And then education and outreach are so important. And we talked about this earlier in the show, talking about CPR videos on YouTube and why we should be educating our public about how we do what we do and when we do it. We also can, every time you teach CPR, you should be reviewing stroke as one of those things that are covered in the chain of survival, and included in cardiac care is recognizing and rapidly assessing and treating stroke patients. So get out in your public, educate them about stroke, work with your local civic organizations and teach them about stroke and how to recognize it, understand the dangers associated with mini strokes or TIAs, and teach your public that, hey, mini strokes mean big stroke coming, and teach it that way. So there's lots of things you can do in your communities for education and outreach, and you can start young. Don't just think of stroke as an old person's disease. So we're going to go to the churches and the old folks home and the civic organizations. You can start teaching stroke management in the schools. Many, many people, students, are living in families where they have elderly grandparents, parents, or others living in the home with them. And, hey, a 10-year-old can recognize the symptoms of stroke and call 911. So let's educate the whole gamut of our communities. There are links in the show notes to follow up on. You can check out those links to the American Stroke Association. The National Institutes of Health have some great information available on stroke and more. And you'll find all those links in the show notes for this episode. And that's going to wrap up this week's episode of the MedicCast. I want to thank everybody for checking out the show this week and encourage you to follow up on all the information in this episode. You'll find links to everything discussed from the news items and the tip of the week segment for additional resources for you over at the MedicCast blog, mediccast.com/blog. Check it out. You'll find a link for the show notes right at the top of the page, and you can click that link to find the most recent episode listed first, and you can scroll down and check out all of the previous episodes as well. So get over there and check out the MedicCast and the pages there. I would also urge you to follow up and get back in touch with me. If you have any comments or suggestions, you can reach me by email, podmedic@mac.com. You can also send in a call to the voicemail line, 941-306-3342, 941-30-MEDIC. And thanks, Sean, again, for calling in on the voicemail line with your comments. Sorry, we had a bad connection and I wasn't able to use the audio, but I understood what you were trying to ask, and I hope I got your question right. If not, call back in. And the rest of you, call in like Sean did and share your thoughts directly with the listeners here on the show through the MedicCast voicemail line. Don't forget to follow me on Facebook as well, facebook.com/podmedic or twitter.com/podmedic. And hey, join the thousands of fans over on the MedicCast fan page on Facebook and share it with your friends. Go to facebook.com/MedicCast and let them know you follow the show by clicking the like button on the top of the page. I post other questions, articles, and links over on the MedicCast fan page, so you can find other good information over there that may not make it on the MedicCast blog, and you can follow what's going on there directly via Facebook. And great to have all of the thousands, a couple thousand fans and more coming on over there. Look to see a whole lot more joining us here in the near future. And, you know, if you're already a fan, you know, head over and check out some of the things and maybe share with your Facebook page and your friends what's going on the MedicCast fan page from time to time by just clicking the share link at the bottom of any of those posts on the fan page. That's it. We're going to close out the show with some great PodSafe music here, and I want to close out with a song by Alyssa Hendricks. This is Good Summer Rain. You know, we're here in the middle of January, and I just think of summertime sometimes when it gets cold like this. So thinking of a good summer rain keeps me positive through the winter months. Check out the link for Alyssa's music in the show notes, and let her know you heard her song here on the MedicCast. That's it. I'm Jamie Davis, the Pod Medic. I'll be back again next week, every Monday morning, with another episode of the MedicCast to kick off your week. And in the meantime, please remember, scene safety, BSI.
I've got this old body to keep me on course, and I've got these old songs, and I've got my remorse, and I have chewed off my nails now. I've been dreaming in verse, and all these lyrics I've been writing are so quaintly perverse. But as my watch unwinds, as my table smolders, I will heave these old keys up onto my big shoulders, and I'll kiss you goodbye long enough to remind me, and I'll steal out the back door and close it softly behind me. But don't ask me for reasons, 'cause I can't explain. There's just something so restless about a good summer rain, and I'm not one to argue. So in all likelihood, as soon as the rain stops, I'll be leaving for good. You'll come looking, you'll follow my trail, and your hair will grow long, and your legs will grow frail. And when it's finally turned cold again, go home and stay dry. You'll find far more comfort in that inked over sky. But if you leave on the porch light, keep the coffee warm, I'll come walking home someday on a warm thunderstorm, and wrapped up in old blankets, no songs and no plans. I will give you my stories, and you will give me your hands. But don't ask me for reasons, 'cause I can't explain. There's just something so restless about a good summer rain, and I'm not one to argue. So in all likelihood, as soon as the rain stops, I'll be leaving for good. I'm not one to argue, so in all likelihood, as soon as this rain stops, I'll be leaving